Hello everyone, I'm Kelly Barnett. Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. Today, we're diving into a common childhood condition that often causes confusion and concern for parents: lactose intolerance. This condition can be quite distressing for both the child and the parents, but with the right information, it can be managed effectively. As a pediatrician, I frequently encounter parents who are worried about their child's digestive health. They often come to me unsure if lactose might be the culprit behind their child's discomfort. It's important to understand that lactose intolerance is not uncommon and can be managed with the right approach. This video aims to equip you with the knowledge to recognize the signs of lactose intolerance in your little ones. By understanding the symptoms and knowing what to look for, you can take the necessary steps to ensure your child's well-being. We'll explore the common symptoms such as stomach cramps, bloating, gas, and diarrhea. These symptoms usually appear after consuming dairy products. It's crucial to observe your child's reactions to different foods to identify any patterns. We'll also delve into the causes of lactose intolerance. It occurs when the body doesn't produce enough lactase, the enzyme needed to digest lactose, which is the sugar found in milk and dairy products. This can be due to genetic factors or can develop over time. Additionally, we'll discuss how to differentiate lactose intolerance from other conditions like milk allergies or other digestive issues. It's important to get a proper diagnosis from a healthcare professional to ensure your child receives the appropriate care and management. Remember, early identification is key to ensuring your child receives the right treatment and can lead a comfortable, healthy life. Don't forget to hit that like button, subscribe to the channel, and leave your questions in the comments below. Let's get started on this important topic. Lactose intolerance is the inability to properly digest lactose, a sugar found in milk and dairy products. This condition occurs when the small intestine does not produce enough of the enzyme lactase, which is necessary to break down lactose into simpler sugars that can be absorbed into the bloodstream. While it's usually not a serious condition, it can cause significant discomfort and impact a child's quality of life. Symptoms often include stomach cramps, bloating, gas, diarrhea, and nausea, which can be distressing for both the child and their parents. These symptoms typically appear within 30 minutes to 2 hours after consuming dairy products. By recognizing the signs early on, parents can take steps to manage the condition effectively. Consulting with a pediatrician is crucial for an accurate diagnosis. The doctor may recommend a lactose tolerance test or a hydrogen breath test to confirm the condition. Once diagnosed, parents can work with healthcare providers to develop a management plan. Identifying and addressing lactose intolerance can prevent unnecessary discomfort for your child. There are many lactose-free alternatives available, such as lactose-free milk, almond milk, soy milk, and other dairy substitutes. These options allow children to enjoy their favorite foods without the associated discomfort. It also ensures they receive adequate nutrition, as dairy products are a good source of calcium and vitamin D, essential for healthy growth and development. Parents should look for fortified alternatives to ensure their child gets these vital nutrients. Encouraging a balanced diet with a variety of foods can help maintain overall health and well-being, allowing children to thrive and enjoy their daily activities without the worry of lactose intolerance symptoms. Lactose intolerance manifests differently in children than in adults. While the symptoms are generally the same, children, especially younger ones, may not be able to articulate what they're experiencing. This makes it crucial for parents to be vigilant and observe for any changes in their child's behavior or bodily functions after consuming dairy. The symptoms typically appear within 30 minutes to 2 hours after consuming lactose-containing foods or drinks. The severity of symptoms can vary depending on the amount of lactose consumed and individual tolerance levels. The most common symptoms of lactose intolerance are related to the digestive system. These symptoms can be quite distressing for children and can significantly impact their daily lives. These symptoms occur because the body cannot fully break down lactose, a sugar found in milk and dairy products. When lactose isn't properly digested, it leads to fermentation in the gut, causing discomfort. This fermentation process produces gas and other byproducts that irritate the digestive system. The buildup of gas can cause bloating and pain, making it difficult for children to go about their normal activities. Keep an eye out for symptoms like bloating, which can make the stomach appear swollen and feel tight. Gas, abdominal cramps, and diarrhea are also common. These symptoms can be particularly uncomfortable and may lead to frequent trips to the bathroom. Your child might complain of a tummy ache, which can be a sign that they are experiencing discomfort from lactose intolerance. You may notice them holding their stomach or curling up in pain, especially after consuming dairy products. These symptoms can range from mild to severe and often worsen with larger amounts of lactose intake. It's important to monitor your child's reactions to different foods and consult with a healthcare professional if you suspect lactose intolerance. Early detection and management can help alleviate their discomfort and improve their quality of life. Section 5. Beyond the belly, other potential signs. While digestive issues are the hallmark of lactose intolerance, some children may experience symptoms beyond the gut. These symptoms can be less specific and easily mistaken for other conditions, making it essential to consider lactose intolerance as a possibility. These less common symptoms include nausea, vomiting, headaches, and even skin rashes like eczema. If your child experiences these symptoms after consuming dairy, it's worth discussing lactose intolerance with your pediatrician. Section 6. Understanding the causes of lactose intolerance. The root cause of lactose intolerance lies in the insufficient production of an enzyme called lactase. Lactase is produced in the small intestine and is responsible for breaking down lactose into simpler sugars, glucose and galactose, for absorption into the bloodstream. When there isn't enough lactase, lactose remains undigested and travels to the large intestine, where it ferments, leading to the unpleasant symptoms associated with lactose intolerance. This deficiency can be due to various factors, including genetics, ethnicity, and certain medical conditions. Section 7. Is it lactose intolerance or something else? It's important to remember that many conditions share similar symptoms with lactose intolerance. Before assuming your child is lactose intolerant, consider other possibilities, such as a milk allergy, irritable bowel syndrome, IBS, or even a stomach bug. A milk allergy is an immune response to milk protein, while lactose intolerance is a digestive issue related to sugar digestion. IBS can cause similar digestive upset, and a stomach bug often presents with vomiting and diarrhea. Section 8. Milk allergy versus lactose intolerance. Distinguishing between a milk allergy and lactose intolerance is crucial as they require different management approaches. While both involve reactions to dairy products, the underlying mechanisms differ significantly. A milk allergy is a serious immune reaction that can cause life-threatening symptoms like wheezing, difficulty breathing, and anaphylaxis. Lactose intolerance, on the other hand, is a digestive issue that, while uncomfortable, is not life-threatening. Section 9. When to seek professional help. If you suspect your child might be lactose intolerant, it's essential to consult your pediatrician or a registered dietitian. Self-diagnosing and eliminating dairy from your child's diet without professional guidance can lead to nutritional deficiencies. A healthcare professional can assess your child's symptoms, medical history, and family history to determine the likelihood of lactose intolerance. They can also recommend appropriate testing and advise on dietary modifications to manage the condition effectively. Section 10. Managing lactose intolerance in children. Managing lactose intolerance primarily involves dietary adjustments to reduce or eliminate lactose intake. This doesn't necessarily mean cutting out all dairy products, as many lactose-free alternatives are available. Your pediatrician or a registered dietitian can guide you on incorporating lactose-free milk, yogurt, and cheese into your child's diet. They can also recommend lactase enzyme supplements that can be taken before consuming dairy products to aid in digestion. Section 11. Living well with lactose intolerance. Lactose intolerance is a manageable condition that shouldn't hinder your child's growth and development. With the right information, support, and dietary adjustments, children with lactose intolerance can lead happy and healthy lives. Remember to read food labels carefully, teach your child about their condition, and encourage open communication about their dietary needs. With your support and understanding, your child can thrive despite lactose intolerance.